He's board certified in both PM&R and pain medicine. Let's all please give a warm welcome to Dr. Mark Hurdle.
So my goal today is to talk about scoliosis evaluation and approach. And most of you will see patients with scoliosis, and we'll get questions about, when do we treat, when do we act, when do we talk to a surgeon, and what sports can we play. I have no conflict of interest with regards to funding, and braces are approved for scoliosis, and so is surgery. Our goals, again, are to review the natural history of scoliosis. So what if you do nothing? What happens? And just observe the patient. And then review the treatment options. The big three, obviously, is bracing, exercise/physical therapy, and surgical interventions. And when do you pursue which one? And then, most importantly, what are the recommendations for athletes with scoliosis? The treatment options and what sports are readily acceptable and what sports are frowned upon, and what's the literature to support this? So people think of the traditional curve for scoliosis, but you have to think of different components of scoliosis, including there's kyphosis and hyperlordosis. In addition, when you think of the scoliosis through the thoracic region, you also have to think about the rotatory component, because the rotatory component can greatly impact your respiratory ability or your pulmonary function. So not only the curve, but the curve as the ribs are twisting like a spiral staircase. People with severe scoliosis, obviously, you think of pulmonary function as well, more with rotatory component than with just traditional scoliosis. So what is idiopathic scoliosis, which I'm going to focus on? It's a curvature of the spine of greater than 10 degrees. And basically, you have to exclude neuromuscular causes and congenital causes. So if they have a inadvertent or a fused level that's kind of causing scoliosis, or a kind of a wedge defect from birth, then that's more a congenital cause. If they have cerebral palsy, Marfan's, muscular dystrophy, that fits into the neuromuscular category. It comes from the Greek word bent, scolios, and Latin is scoliosis, so it speaks for itself. How do you measure it? Well, there's two primary ways. Basically, as you all know from sports physicals, if you